when you're doing the exam, you want to make sure that you're looking at the front, the back, and all that kind of stuff. So as silly as this may sound, I just want to remind you, what bone is this here in the front of the knee?
Patella.
The patella. That's always going to tell you the front. Also, the foot's facing forward. Again, I can't tell you how many times students have gotten that front and back mixed up because the skin isn't here, so it's a little bit confusing. So make sure you look for the patella and the foot. Here's another one. This band right here we're going to learn is the iliotibial band. This is always lateral. It's out over here, right? So your iliotibial band, it's like a belt of connective tissue, and it goes from your ASIS way up here all the way down past your knee to your tibia, and it helps to stabilize the knee. Always is on the lateral, okay? So the kneecap, the toes for the front, iliotibial band is lateral. In the back, guys, this little indentation is behind the knee. What's the back of the knee called from the first day? What region? Popliteal, right? Remember the popliteal region? So this is the popliteal fossa. This is always the back. If you kind of put your hand behind your knee, right, there's that little space back in there. We're going to see that the hamstring muscle split here so that we have the space. When you see this is always the back of the knee. A lot of times too, you can use the gluteus maximus, but when we look at the models, we take this one off. So it's a little bit hard to tell front from back as you take the muscles off, all right? So make sure you're looking for this for the back. And then again, as silly as it may sound, the inside of the thigh, use the big toe, right? If you look down, your big toes are on the medial side of your thighs, or the medial side of your lower extremity. So use those landmarks, otherwise you do get confused, okay? Everybody with me? Everybody get the attendance sheet? Okay. So, let's do this. Let's start with a muscle that's on the lower extremity, but I want to show it to you here first. There is a muscle. Who's going for physical therapy again? Who wants to do physical therapy? So you guys, when you do PT, you'll learn this as two distinct muscles. I'm going to marry them together. One is going to be called the iliacus, and the other one is the psoas. So what I did, if you take a look at my first, all the way to the right, guys, I married it together. I'm going to call this the iliopsoas. The reason I can do that is this. In the pelvis up here, there are two muscles, but then they blend together to become one tendon that goes into the lesser trochanter. So check this up over here. Can you see this, guys? If you can't see, just come a little bit closer. In the iliac fossa, this muscle right over here, this is the iliacus, and then this big band right next to it here is the psoas major. And you can see it's spelled P-S-O-A-S. The P is silent. We just say psoas. So watch this. What I do, we marry these two together. We're going to call it the iliopsoas. Then it goes underneath the inguinal ligament, and then we're going to follow it here, going to the lesser trochanter. This is a muscle that does this. When you flex your thigh, you bring your thigh up like this. Say you're on a treadmill, you're climbing stairs, or even just walking. If you're flexing your thigh, this is an important muscle that brings our thigh up. So, just to show you where it is on this one, watch this, guys. So we want to make sure we're looking at the front, correct? Here's the inguinal ligament. Here's the hip bone or hip bone. So here's the iliacus. For those of you going into PT, you'll learn this as the iliacus. Here's the psoas major. So I'm going to call it, and that's what I want you to call it for my test, iliopsoas. That's the muscle. Now watch this. If I take this other muscle off for a second, just move this guy for a minute. Watch this, guys. This tendon right here that's going into the lesser trochanter, that's the tendon of those two muscles. See how it became one? So on the test, if I put a sticker here, here, or here, the answer is iliopsoas. It's all the same, okay? Anybody questions on that? What does it do? It's a hip flexor. Remember we said flexion is when we decrease the angle of a joint? So you should have an idea like what each muscle does, like one thing that the muscle does, okay? Questions or comments? Okay, beautiful. So let's bang down this here. Iliotibial band. So this right here, guys, this is the iliotibial band. I will let you abbreviate it also. We usually say in medicine the ITB. iliotibial band. So if you want to say that, or you want to say ITB, I'm down with both of them. They're both good. Okay? What does this do? Just so you know, like I said, it crosses the knee on the outside, and it prevents your knee from doing this, becoming wobbly like out this way, so it doesn't dislocate. So when you walk, that band actually gets pulled tight by another muscle I'm going to show you now, and when it gets pulled tight, it stabilizes the outside of your knee. Okay? So here's your iliotibial band. What's the muscle that pulls it tight is this little guy right here. So watch this. This muscle here, see how it goes into the iliotibial band? When it contracts, it pulls this band tight to stabilize the knee. So this muscle is called the tensor fascia lata. Tensor means that when it contracts, it's tensing. Fascia lata in Latin is the iliotibial band. Okay, so this muscle tightens this band. Am I pointing to it? This band, so that it stabilizes the knee. Okay, this little guy right here. So watch this. I will let you abbreviate this one too, because again, a lot of times in PT and in medicine, we'll say the TFL. So watch this. The TFL goes into the ITB. The two things I'm going to let you abbreviate, they go together. The TFL goes into the ITB. Okay? This tenses the ITB. The name tells you what it does. Okay? Anybody questions on those? Pretty easy, right? Okay. So we have the iliopsoas, 1, 2, 3. All of this is the same muscle, iliopsoas, the iliotibial band, where'd it go? Right here, and the TFL, tensor fascia lata. What's my next muscle, Joe? You read that for me after that.
The gluteus maximus.
Okay, let's do some of the muscles up on the back of the hip here. So watch this, the posterior muscles, we have one muscle called the gluteus maximus, that's posterior, most of us know that one already. But watch this, here on the side of our hip, out here, there is two muscles that are also gluteals, the gluteus medius and the gluteus minimus. Right, so we have the max, and then the two other ones are on the side of the hip. So let's take a look at this. How do we know we're looking at the back? What's that space again? Popliteal space, right? The popliteal space. So this broad, flat muscle back over here, nice easy one, this is the gluteus maximus. Now watch this, on the side of the hip, remember I said they're on the side by the lateral? How do I know I'm lateral? What's this? ITB, the iliotibial band, good. See this muscle over here, guys, on the side of our hip right here? That is the gluteus medius. The gluteus minimus is there too, but it's under there. We can't see it. So you're not going to be able to see the gluteus minimus, but it's underneath the medius. It actually looks the same. So watch this. Let's take the max off for a minute. We're going to pop that off. And here's a good visualization of the gluteus medius. Right? So it's kind of like this triangular muscle out over here. Gluteus medius. Again, part of it's covered by the maximus when the maximus is in place. But when you take the maximus off, you can see the whole muscle. Okay? So that's our gluteus medius. Where's the minimus? Underneath. You're not going to see it. So on a test, if I put a sticker here, just give me, you can say medius. Okay? We'll leave it at that. You want to cross out minimus, you can. Say again? Okay, that's going to be your medius. Okay? Now, watch this. The next 6 muscles, I grouped them for you as the deep lateral rotators. So if you remember when we did the joints, lateral rotation, let's pretend this was my femur. Lateral rotation would be taking the femur and turning it out. So the next 6 muscles all do the same thing. They're going to take your thigh and they're going to turn it out. When you do dissection, they're going to be in this order. You don't have to write this down. I have it in the notes for you. That piece of chalk real quick. This is the way I used to remember when I was in school. I would go, please go quietly. It was kind of like a little mnemonic that I had in my little acronym. I would say, please go quietly. And we would do dissection. So once we reflected the gluteus maximus back, the 6 muscles went exactly in this order. The first muscle you're going to see is going to be the piriformis. Again, I have it written down for you. Then the gemellus superior, obturator internus. You're going to see the gemellus inferior. Now watch this one. The next one, obturator externus. That one you're not going to see. So put a little asterisk next to that one. Obturator externus. Our dissection here, we just can't see it. We would have to cut it differently in order to see it. So none of the models that I have are going to show it. But I want you to know it in theory as far as the order, especially you guys going into PTs, you ladies and gentlemen going into PT. All right, so this would be the obturator externus. And then finally, the quietly is quadratus femoris. All right, so if you kind of remember that little mnemonic, please go quietly. You'll remember the order of the muscles: piriformis, gemellus superior, obturator internus, gemellus inferior. Anybody know, sometimes in Italian language, and even some Spanish, what's gemella mean? Anybody know?
Isn't it
Twins. Yeah, very good. Twins. These were twins, and the anatomist looked at it. They had a upper twin and a lower twin. So this was gemellus superior, gemellus inferior, right? Gemelli. Obturator externus is the third. The fifth one, and then the quadratus femoris. So watch this. Come up, come close. Bring your chair around here. Because I'm gonna hang up nice and tight today.
Which one did you say the cross?
So watch this, guys. If we take off,
No, you're having
what muscle was this? Gluteus maximus. Everybody agree? Gluteus maximus. What muscle was this? Gluteus medius. If we cut the max away, you know what? You guys gotta come around a little bit. You're gonna miss this whole thing sitting in the corner over here, right up here in the front, so you can see it. You guys can see it too? Because if you're gonna miss it, you're gonna have a problem with it. The first thing you gotta do is find piriformis. How do you find the piriformis? See this yellow line right here? This is the biggest nerve in the body. This is the sciatic nerve. The piriformis always comes up, or you're gonna find, I should say, above the sciatic. So find the sciatic nerve first. This muscle right here is gonna be your piriformis, okay? So sciatic nerve, this muscle is piriformis. So what's the next muscle then? Go with your mnemonic. Gemellus superior, so that's this one here. Gemellus superior, obturator internus, gemellus inferior, obturator externus, you're not gonna see. So that one don't look for, you're not gonna find it, but I want you to know it in theory. And then what's the big one underneath? Quadratus femoris. You can see it's kind of quadrangular, with something that's quadrangular, it's almost like rectangle. So that's where they come up with the term quadratus femoris. Again, so what's the nerve? Sciatic. Where's the piriformis? Above or below it?
Above.
Always above. So find that. Once you find your sciatic nerve, piriformis. Again, what's the next one? Gemellus, please. Right, to be gemellus superior, obturator internus, gemellus inferior, obturator externus. We don't see. Last one, quadratus femoris. Right? Please. Go quietly. Even when I used to do dissection, I even taught dissection, right? It was always that way. It was such an easy area. Even though you got to get just used to the names, it's not that hard. Okay. What's their action? They all do what? What type of rotation? You'd have to be lateral, right? You have to be specific because there's medial rotation. We're not doing that here. This is only doing lateral rotation. So that's why I group those together as your lateral rotators. Sometimes I even call them the deep 6 lateral rotators because they're deep to the max, right? They're underneath the maximus. I'm sorry.
Thank you.
Okay. What's my next group there, Joe?
Adductor.
Okay, so watch this.
That nerve only runs down the left leg, right?
Say again?
The sciatic nerve only runs down the left leg?
Both legs.
Both
So you
legs.
have a sciatic nerve. Watch that. It comes out of your like your butt area right here. The sciatic nerve emerges here, and then it goes down the thigh on the right. That one over here too. So it's bilateral. Yep. So the next group, I tried to, again, give you the action by giving you the adductor group. If you remember, adduction is if we take a body part, say this is away from our body, and we bring it close to the body. So this movement of bringing it back to the body, that is adduction. If you were going to adduct your thighs, it would be taking your knees and bringing them together. Or if your legs were apart like this, bringing them together like that. That's adduction. So these muscles, there's actually 5 of them, but I'm going to have you know 4 because we can only see 4 on here. These all do adduction. So if I asked you, what does gracilis do? It's part of the adductor group. It does adduction. It's that simple. Okay, so I tried to give you it as a group. So watch this, guys. This is going to be on the medial side of your lower extremity. Is that the medial side? Why?
The IT band is
There you go, right? This is the lateral side. You got to make sure you're looking at it. Is this the medial side?
No.
Nope. Why?
It's front.
Patella here, right? How do you know the medial side? You got to look at that big toe. Okay, so here's the big toe. So this is the inside of your thigh. You know what? I forgot to change the order. We're going to do number 4 first. The first muscle I want you to find, I got to just change the order next time I make that chart up, is the gracilis. So watch this. This muscle right here, that's the most superficial on the inside of your thigh, this is called gracilis. It's like a, reminds me of like a belt or a strap that comes down. It goes all the way from the pubic bone past your tibia. So this is the gracilis. Find that one first. Then watch this. The muscle behind the gracilis, posterior, is a big muscle. It fills up most of the inside of our thigh. This is going to be called adductor magnus. So find that one next. Right? So find the gracilis, then find the adductor magnus. Go back to the gracilis, and the muscle in front of it is the adductor longus. Okay? So gracilis is your starting point. Muscle behind is what? Adductor magnus. Go back to the gracilis. The muscle in front is the adductor longus. Then watch this. Take your finger, if you follow it up to the pubic bone, right to here, the muscle right next to it there, this little dude right up under the pubic bone, is the pectineus. Pectineus. It's a little muscle. It's right up underneath the pubic bone. And again, what I would tell my students to do is follow your finger up with the adductor longus, the muscle right next to it, right there, under the pubic bone. Pectineus. Okay? What's this whole group do? Adduction of the thigh. Okay? Bringing the thighs together. That's it. Okay? That easy. There's another muscle. Again, though, you guys going into PT, you'll learn, and you don't have to know it from me, the adductor longus has a muscle underneath it called the adductor brevis. So this is like a long muscle, and then there's a shorter version of it underneath there. So just so you know. Okay? Oh, what's next, Joe? Adductor group. Which one?
Sartorius.
Ah, sartorius. Let's put him back a second. Okay, so watch this. The next muscle, the sartorius and the quadriceps, are the front of the thigh. That the front of the thigh? Am I correct? Okay. So watch this. The longest muscle in the body is another strap. It goes from the ASIS over here, and watch this. It rotates around the thigh like this. So on you, it would be here, and then it goes around the thigh like that. Just kind of like acts as a strap going around that way. So that muscle is called the sartorius muscle. What this muscle does is exactly what she's doing over here, if you have your legs crossed. This muscle allows us to do this, to cross our ankle over our knee like that. It actually rotates in such a way that we can cross our leg. Years ago, they called this muscle the tailor's muscle. Because watch this, a tailor would sit down, cross their leg like this, put the garment over their knee, and then they would sew and they would alter whatever the garment was. So you needed that muscle to do this. So some people called it the tailor's muscle. For me, I'm going to have you call it sartorius. So again, starts way up at the ASIS, and look how it goes like a band around the quadriceps, around the front of your thigh. Real easy muscle to identify, sartorius. Okay? Anybody questions on that one? I'm gonna take this one off, so let's pop this off. Now, just deep to the sartorius, right, we removed it. This muscle right here is the most superficial of the quadricep group. What does quadra mean anyway? Quad? Four, right? So it's going to be a group of 4 muscles. So find this one first, guys. It's called the rectus femoris, or some people say rectus femoris. However you want to pronounce it, it's good. So this is the rectus femoris, all right, or femoris. Then the next 3 muscles all have the same name, vastus. And it's going to be named based on its position. So watch this. Right next to the rectus femoris, this muscle here is the first vastus. It's called the vastus medius. So it's going to be on the medial side of the rectus femoris. So vastus medius. What do you think this muscle is going to be called on the outside of the rectus femoris? Vastus lateralis or lateralis. Lateralis, right? Lateralis.
Yeah.
It's a couple of sometimes this is also called vastus medialis. What did I have in there? Medius or medialis?
Medius.
So if you said medius, that's fine. Medialis is fine. That's okay. So vastus medialis or medius, vastus lateralis, right? So they're on either side of the rectus femoris. Vastus intermedius, watch this. If we take the rectus femoris out, between the medius and the lateralis here, this one in between is the vastus intermedius. What does inter mean? Between. It tells you it's between, right? So it's real easy. We could also see it this way. If I took the rectus femoris off, and I pop this off, and I kind of turn it around, see these fibers here? These are the fibers of the vastus intermedius. So we can see it here, or running straight up and down this way. Okay? What's the most superficial muscle of the quads? Rectus femoris. This muscle just inside. Vastus.
Lateral.
Nope, vastus. This big one right here. Inside of your thigh.
Longest.
Good. Medius, right? Vastus medius. If you want, you can actually grab that. Go like this. Take your thumb and forefinger, that chunk of meat right there on the inside of your thigh. That's vastus medius. Right there. Okay. So one more time. Rectus femoris. If I pop it out, here's your 3 vasti. Which one is this one? Vastus medius. Vastus intermedius. Vastus lateralis or lateralis. That's simple. Okay. So 1 rectus, 3 vasti. Okay. Hamstrings next.
Yeah.
Okay. Hamstrings, you probably know, are in the back of our thigh. So is this the back of our thigh?
Yeah.
Yep. How can I tell? Top gluteal space, right? Can I tell the gluteus maximus is missing too? So you got to make sure you're looking at this, right? When the muscles are off, it gets a little bit more difficult. So watch this, guys. Hamstrings is just 3 muscles. One of them comes down on the lateral side. Is that the lateral muscle? Am I correct on that? Right. Why? What was this? ITB, right? The iliotibial band. Good. You guys are getting it. So the one that comes down on the lateral side is this one, but then 2 of them come down on the medial side. Right? 2 of them come down on the medial side. So 1 is on the lateral side, 2 are going to be on the medial side. Let's do the lateral one first. It's easy. This one is called the biceps, just like this one here, but you got to say biceps femoris. It's telling you it's the bicep on the femur. Anybody know what we call this one as a full name? The biceps brachii. Good, but brachii. Good. Telling you that. What does brachia mean? Arm. So it's the bicep on the arm. So now that we know that there's 2 biceps, you have to distinguish. In the past, I wouldn't say anything. Or even myself, I don't say anything to you because I didn't even know there was that second bicep. So this one you're going to call bicep what? Femoris. Now watch this. The next 2 muscles are going to be called, I call them the semis. But watch me for a second. One muscle is broad and it's deep. The other muscle is going to sit on it like this, and it's going to be more narrow, and it's going to have a long tendon. So the deep one we're going to call semimembranosus. It's like a membrane. Think of it kind of being like a membrane, being wide. Semitendinosus is the one on top, and it's going to have a long tendon. So again, I'm going to give you time in a little bit to take pictures and get up close and take a look at them. I put the models out. So watch this. Let me take this off for a second. Let's see if we can do this without falling apart too much. So here's the two muscles. Between my thumb and forefinger here, guys, right there between my thumb and forefinger, that's the broader, deeper muscle. Then take a look. See this muscle on top right here? That muscle on top is the superficial one. The broader, deeper one you're going to call semimembranosus. The superficial one with the long tendon, semitendinosus. Right? It actually shows you it has a long tendon. And when you put it on here, you can actually see the long tendon kind of continues down over here. See this right here? That long tendon. So it's easy to distinguish. All right, so think of the one broader and deep, semimembranosus. The one sitting on top, superficial, semitendinosus. Okay. What's the lateral muscle? Biceps, what? Femoris. Biceps femoris. What's the deep medial muscle? Semimembranosus. The superficial medial muscle? Semitendinosus. Remember, the two semis go together. Okay? The broader one is like a membrane. It's going to be wider. Semimembranosus. The one that has the long tendon? Tendinosus. It's that easy. Okay? All right, so let me put this guy back together for a second. Before I do the lower leg, let's just do a little review. The biggest problem is trying to keep these muscles on here. Thank you. Beautiful. Just going to turn it the other way. Yeah, that's good. Thank you. Okay. And the big guy. Let's put him back on there. We'll actually do him first. Okay. So I'm going to go out of order. Again, I'm going to point. You guys just shout them out. Okay. Identify this muscle. Gluteus maximus. Let's take that one off here. Identify the structure. ITB or iliotibial band. Fine. The muscle that goes into it. TFL. Good. Remember, TFL, ITB. The two that I'm going to let you abbreviate, think of them together. The TFL tightens the ITB. Nice and easy. Good. Identify the muscle up above the inguinal ligament. What's these muscles here? Iliopsoas. Good. Excellent. Iliopsoas. That was the first muscle we did. Good. Identify this long strap-like muscle here. Sartorius. Sartorius. Good. Identify this front muscle here. Rectus femoris. Good, I heard it. The muscle next to it. Vastus. Inside, right? Vastus what? Medius. Vastus medius. Good. The one on the outside? Vastus lateralis. Right? You like that intermediate. So I want to make sure I put that on the test for you. Vastus medius. Vastus lateralis. Where would the vastus intermedius be? Under what muscle? Under the rectus femoris. Very good. Right under the rectus femoris. One more time. Identify this muscle. Sartorius. Identify this muscle up top. Iliopsoas. Good. Identify this structure. ITB. Is this the inside or the outside of the thigh? Outside. Identify this bone. Patella. Good. Identify this long strap-like muscle.
Rectus femoris.
All right. So what are we looking at? What view?
Oh, that's the
Medial view. Good. So the first one you want to find is the last one on my list. Gracilis. Gracilis, right? Gracilis. What's the big guy behind it?
That's the adductor magnus.
Adductor magnus. I meant to say, what does magnus mean anyway? Big. It's a big muscle. This muscle, we're only seeing a part of it. It fills up most of the inside of our thigh. Very good. So that's the adductor. One more time. Magnus. What was the first muscle we had to find? Gracilis. What's the muscle in front? Adductor longus. Good. Then if you follow your finger all the way up to the pubic bone, go over one, that is the pectineus. Pectineus. Okay? Good. One more time. What was this muscle? Gracilis. What does this whole group do? Beautiful. Adduction, right? ADD. Good. Excellent. Is this the hamstring group?
No.
That's sharp. I can't fool you. What was this muscle one more time? Rectus femoris. Yeah, excellent. What are the three? Have the same name. This is going to be the vastus medius, vastus lateralis. Where would the vastus intermedius be? Under the. You guys got it. Identify this group in the back of the thigh. Is this the back of the thigh?
Yes.
Good. Are you sure?
Yes.
There's a kneecap here, right?
Yeah.
Now, what's that space?
Popliteal.
Popliteal space. Good. Good. What's the lateral muscle back here? Biceps femoris. Excellent. The two muscles that run medial are the semis. What's the deeper, broader muscle?
Semimembranous.
Good. And the superficial muscle? Good. What's this group called?
Hamstring group.
What nerve is this? Sciatic nerve. What's the muscle that always comes out above the sciatic nerve?
Gracilis? No.
So go ahead, go back to look on the board. What's the mnemonic first of all? Please go quietly, right? So you gotta get that in your mind. So P, the P word. What's the P word?
Pectineus.
Not ephemeris. Piriformis. Oh. Good. So piriformis, so that's our P. Gemellus superior. Obturator internus. What's the next one? Gemellus inferior. Can you see the obturator externus? No. Last muscle? Quadratus femoris.
I can't see it.
What muscle is this up over here?
That is the gluteus medius.
Okay. Just real quick. Sometimes, and I get it, these are just common mistakes I've seen on practicals. Sometimes students mix up the piriformis with the medius. They look alike, but how are you going to tell the difference? You're always going to go by what nerve? Sciatic nerve. The muscle above the sciatic nerve is the piriformis, right? This is a more lateral muscle. It's a bigger muscle. The gluteus medius is a much bigger muscle than the piriformis. Although I get it. I can see why students get that mixed up, but I don't want that to happen to you guys. So you want to keep that differentiated, okay? Okay. Anybody, questions up over here? Again, it's just that kind of repetition. That's the way you want to test yourself, just kind of pointing and verbalizing the words. Right? It's the easiest way to do it. So let's take a look at the leg. So remember day one,